My name's Ballesteros, and I am the CEO of JWCH Institute. I am a bicultural, gay individual who was raised in the Latino community, and I'm from Los Angeles. Back around 15 years ago, and this year's the quinceañera of Adelante, so it's 15 years. I was in HIV and AIDS and trying to figure out how to get education out to Latino communities, trying to figure out how to get important information about where folks can get tested, how they can protect themselves. In LA, there was a couple of mainstream magazines. There were some big ones, but they were mostly English magazines, no Spanish. And they were targeting West Hollywood in those areas, and no matter what we did in terms of putting advertisements in there or putting articles in there, it never really resulted in individuals accessing care. There wasn't the vehicle. So me and my partner had a conversation, and I said to him, we need to form something that can be a vehicle to get the information out to people, that can be put into the gay Latino bars. It could be put into the other nightclubs where gay Latinos potentially go. It could be put on the newsstands. It could be put in community agencies where it would be an attractive magazine, but within it was pages where individuals could go get tested, where they could go get health care. And so one night when he and I were talking about it, it was at my kitchen table, I said to him, we just need to do it. And that night, so I slept on it, and I was thinking about names, and I thought about the name Adelante because, it meant progress. It meant movement forward. I think it took us about 2 weeks to get the issue together. We took it to the printer. We didn't know what it was going to be, but it became a vehicle that was put in many, many different places that carried within it important HIV education that I think has made a difference in curbing the spread of this disease. Well, the disease, HIV, has really changed, and I've seen it firsthand. Today people are going to live normal lives. It's a chronic illness. I am one of these long-term survivors, 28 years. I have been living with this longer than I have not been. And, the time when I found out, I wasn't supposed to make it. There really wasn't a lot. And the way that I made it through it, and I know this must sound crazy, but was to work as hard as I could. I figured if I could just continue working and my focus forward in terms of advocacy, that I would be okay. Now, too many people are getting infected. We have a disease today which is completely preventable, and there are, we know how it's prevented, and that information is out there. So, unfortunately, the change around the mindsets of individuals that put themselves at risks hasn't been there as well as we would want to see it. Very fortunate to be the ED of a major healthcare federally qualified health center in Los Angeles. And I take that job very seriously. And the environment that I try to create there is one of inclusiveness. There's great diversity amongst the staff. There's great diversity amongst our programs. We serve everybody. And I think that's the way healthcare ought to be. Again, I go back to, I grew up uninsured. I grew up in a family that had health issues, had substance abuse issues, and I'm trying to create a system of care for people that can address whatever that individual needs, whoever they are, from whatever walk of life they come from. So it's exciting because as a CEO, you get to do things, and if your board supports you, I have a great board of directors, and they do, but you get to do things that you feel are going to be responsive to the community. And I think the reason why we're successful is because we're creating access to a system which I believe is completely responsive. If there's a program that we think people need, we're going to do it.